Right. You sort out your tablets and your patches. I get exhausted. I get frustrated. I don't feel valued. There's very little feedback. So that's difficult. Just sit this for a minute.
When Pat's husband Jeff was diagnosed with Parkinson's disease,
I'll put this one in.
she became his primary carer. At 80 years old, she works day and night to support him in the home they've shared for decades.
We get some help from the local authority. Currently, I'm subsidising that by about a third. Okay, that's it. I'm also meeting all of the household bills and covering all of the household responsibilities, which is just wearing. Yeah.
If Jeff needs to go into a care home, they will need to give up their house.
We'd certainly have to sell to fund his care, yeah. So that would be another upheaval. We'll see.
I'm now the Prime Minister.
You what?
He's the Prime Minister.
What, a new one?
Another one.
Man, I keep changing every time.
I know.
Visiting a care home this morning, a Prime Minister with a personal tie to the social care crisis.
Lovely to meet you.
Andy Burnham's father has Alzheimer's, and he says he is determined to overhaul a system used not just by older people, but by anyone who needs support.
I think social care in England is as unfair as American healthcare.
In a speech full of passion but light on detail, he declined to rule out tax rises to pay for any reforms, but said reforms were coming.
It's a major dereliction of public duty that Parliament has not faced up to this, of all challenges, something so fundamental to life as this. It's shameful, to be honest.
It went down well in the room. The Prime Minister said a review into social care will be speeded up, and he'll look at creating a publicly funded national care service for England. Andy Burnham's had 17 years to think about this. He first proposed a universal system of social care as Health Secretary under Gordon Brown. But this attempt, like many others, to fix a broken system failed to get off the ground.
22 reviews in the last period of time, in the last 30 years. It's an enormous time, and it's been ducked really over those years. We haven't got to the next stage.
Because of cost? Is that why it's been
It's because of cost and politics as well, if I'm honest.
But this afternoon, the Prime Minister did manage to arrange brief cross-party talks with the Conservatives and the Liberal Democrats about a way forward. Was it worth it?
Well, it certainly set out the plans that he has in mind in terms of the cross-party talks. I mean, we didn't really go into the detail, it has to be said, because I think that is for future discussions, but it was very much about the principle of having a discussion about where we can find common ground, where we agree on issues, and also being honest about where we don't agree.
But from those left out today, there's already dissent.
This Prime Minister has said throughout that he wants to devolve power, that big decisions over people's lives need to be taken as locally as possible. Yet what this social care plan does is the complete opposite, by effectively nationalising and centralising adult social care, which is currently carried out by local councils all over the country.
We can put you out in the garden.
Warm words from the Prime Minister are welcome, but after decades of failure, difficult decisions lie ahead.
I'll go and sort out a bit of lunch for you.
If people like Pat and Jeff are to secure the dignity they deserve.
And Catherine is in Westminster for us now. Catherine, the Prime Minister also had something to say about the assisted dying debate. What was it?
Yes, for the first time he made an intervention here. He addressed the topic of assisted dying in England and Wales. He said consideration of that debate should only take place once palliative care and social care were fixed. Now, that is a big departure from Keir Starmer, who, as you know, personally supported assisted dying. And there is going to be another attempt to bring it back into the House of Commons in September. But it's worth noting that just as assisted dying has moved at different stages in different parts of the UK, when Andy Burnham is talking about having a big conversation about social care, he is talking about England. In Scotland, there is free personal care for the elderly and for those who are eligible. I looked that up. Introducing this in England would cost £7.8 billion. It's a choice. Maybe it's a choice you'll make. Scotland tried to introduce a national care service. Those plans were only abandoned last year after opposition from politicians, councils and trade unions. Meanwhile, in Northern Ireland, though, health and social care are integrated into a public system. So the Prime Minister, as he goes through discussions in the next months, may want to look to other parts of the UK for inspiration, yes, but for lessons too in what can go wrong.
Catherine, thanks very much indeed. Well, earlier I spoke to the Housing, Communities and Local Government Secretary, Angela Rayner, and began by asking her for more details on Andy Burnham's ambitious plans to finally fix social care.
Well, I've waited a very long time from when I was a carer 27 years ago to hear a Prime Minister speak directly to the nation about the challenge that we have in social care. And the frustration for me is that it's always comes back to, tax, but actually there's a huge amount of money that's in the system where people are on hospital trolleys or they're waiting to get out of hospital because they don't have the care in the community. And as someone who started off in that sector, I know carers do a huge, incredibly valuable job, but they're not recognised for that. So we started the work on fair pay agreements and the Employment Rights Act that I spearheaded previously.
I mean, I hate to bring it back to tax, but it will involve funds from somewhere. And, when Andy Burnham tried to reform social care in 2009 with a flat tax, it was labelled the death tax. When Theresa May tried to fix social care as one of her signature issues with a tax, it was called the dementia tax. I mean, the road to social care reform is littered with political bodies from both parties, including our current Prime Minister.
Well, again, this is why the Prime Minister has said we need to come together and not play politics with it. He acknowledged not to bring it right next to an election so it doesn't become a political football, and that to genuinely put the people who need the care, our loved ones, right at the heart of the policy making. The Prime Minister talked about ending the profiteering as well. So really delivering care in the community that people need will save money but deliver better care for people. And I welcome that emphasis, and I welcome the emphasis from the Prime Minister of reaching out across the political divide and into people's living rooms and saying, I want you to be part of that conversation.
But if he really wants to have a national conversation and he's reaching out across the political divide, why didn't he invite the SNP or the Greens or the Reform Party to this summit, which is supposed to bring the nation together on this issue?
Well, look, both the leader of the Liberal Democrats and the leader of the Conservatives have wrote to the Prime Minister. He's been in office, this is his 10th day, and he started that conversation. We will reach across the political divide. I'm certainly willing to speak to any member of Parliament who wants to talk about this, and I think the Prime Minister was really clear on having that national conversation to take it out of the politics, the party politics, and actually talk about what do we want to see a national care service deliver.
But local authorities will tell you that the funds they have at the moment are simply not enough to deal with social care. It's killing them on the local level. So something has to be done on the national level. And again, I wonder if, because the Prime Minister hinted at possible tax increases in his speech today, is that what's going to happen? Will there be tax increases, or would you rule them out?
Well, again, the Prime Minister said that he's sticking within the promises that we made at the manifesto. We need a system that can respond to people's needs instead of actually shunting it into the NHS, where people often end up stuck there and they can't get back out into the community quick enough, and that again costs more money, and it's not right for people who need that care, and often they don't want to go through that process.
Just in terms of the last, 8 days since you've been in office, I mean, almost every day there's a massive signature policy announced. We had NEETs yesterday, the ending the early release program at the end of last week. I mean, are you setting yourself up with these extraordinary ambitions for failure if you don't manage to deliver?
No, I don't. I think that, Andy's had a lot of time in politics. He's taken on the thorny issues, and a lot of them are knitted together and intertwined. Yesterday, we were talking about not in education, employment and training and opportunities for young people. We've got vacancies in the care sector, so lifting and recognising the skills that carers have and then creating a pathway where young people can see that as a career for them is a way of solving both of those challenges that we face.
He's also brought you back into government after your detour courtesy of some tax issues. Did you do a deal with him to stay loyal to him in return for a decent job?
There was no deals done. I mean, I'm inspired by what the Prime Minister is saying. I believe that we've got a real opportunity to see some of these challenges and to really make a difference, and I'm willing to roll up my sleeves and work with Andy, work with the different political parties and our communities and countries.
Angela Rayner, thank you very much.
Thank you.
So how is social care paid for in other countries? Ria Chatterjee has been taking a look.
England is something of an outlier among wealthy nations when it comes to paying for social care, according to analysis by the Nuffield Trust think tank. That's because many other countries have systems giving some free care to everyone without means testing. Take Japan, a country with one of the world's oldest populations. Elderly people who need care get a monthly state-funded payment towards the cost. The amount they get is based on their needs. It's funded by taxation as well as mandatory insurance premiums paid for by those over 40. But people receiving care are still expected to pay between 10% and 30% of the cost themselves, with extra accommodation charges for care homes. In New Zealand, home care is free for anyone over 50 who needs it, and care home costs are capped at about $1,500 to $1,600 a week, depending on the region. That's about £640 to £690. In Germany, the state funds some care for everybody who needs it. Footing the bill, a mandatory insurance scheme paid for by both workers and employers. But individuals pay the rest of the bill regardless of their means, and there's no cap on these costs. Unusually, if an elderly person can't afford it, their adult children can be forced to pay. That's if the child earns over €100,000 a year. Denmark has a particularly generous model, with all social care free for everyone and paid for through general taxation. But that excludes accommodation costs in care homes, which people have to pay themselves. A system similar to this would cost £18.5 billion a year in England, according to analysts at the Health Foundation.
Now, Sir Andrew Dilnot is an economist who was tasked by the government back in 2010 with chairing a commission to find a fair and sustainable way of funding adult social care in England. Sounds familiar, right? Well, he joins me now live from Oxford. Sir Andrew Dilnot, it's great to have you on the programme. Your commission was always the kind of, the yardstick, and now we've got another commission. Do we really need another commission to fix this problem?
So I don't think we need another commission to try to work out what we should spend the money on. I think the analysis of that has all been done. I think we probably do need another something to help us come together and agree on a way of raising the money to do it, and something that can bring some kind of political consensus. So I don't think Louise Casey and her team are going to be spending much time trying to work out what it is that they'd like to do to make things better, but I think there is a hard job persuading people that they are going to have to pay for it. And of course that's a perfectly reasonable thing. This is something that makes things better for us, but it can't come without some cost. So
what we really need is, coming together as a nation. We need to actually address this issue. People don't want to talk about it. I mean, I think, in a recent poll, it's 4% of people really cared about social care. And I guess if you're not old enough to care about it, you just don't want to know about it. How does the Prime Minister, translate his good vibes and optimism into something that actually creates a mandate for him to take difficult decisions?
I think some of it is about communication. You're right, people tend not to like to think about it until the issue comes and faces them very directly. But the truth is that 80% of us, 4 in 5 of us, are going to need social care in our old age. So it's coming to almost all of us, and it is an issue that we're going to have to address. And at the moment, it's the only big risk that we all face that we can do nothing about. There's no way of ensuring it. It's not insured by the state, like our health problems. It's not insured by the private sector, like our house burning down or a car crash. So it does terrify people when they get close to it. We somehow need to find a way of making us all, and I include myself, the whole population in this, think about it in advance and recognise that we can do something much, much better than what we're doing at the moment, but we need to face up to it.
And as a country, we really haven't done very well. Other countries have done better. Ria Chatterjee gave us a list of them. Which model do you like?
So probably the model I like best, but maybe I would say this, wouldn't I, is the Australian model, because in Australia they have a version of what we proposed in 2011 for this country, and that is that there's an amount that people are expected to pay for themselves, but once they hit a cap, the state comes in and pays. And the reason I'm attracted to that is that it means that the worst risk, the biggest risk that we all face, is taken away. And once that biggest risk is taken away, it leaves us much better placed to manage for ourselves. Many of the other countries that were mentioned in that very helpful report, they have something that pays something to everybody, but it also still leaves the people with the most difficult cases exposed to enormous risk that isn't supported. So if you have dementia and need to be in a care home for 10 years, you can still end up in very serious problems. So I think the model of putting a cap on the amount that people can pay is critical. Of course, Andy Burnham might well say, well, he'd like a model like that, but he'd like the cap to be zero. Well, I'd like the cap to be zero as well, but I don't think we can get there in one step. And if we're not to, then I'd start with those very worst risks.
You know, and caps translate into money and all that. I mean, the plans that they're going to come up with apparently are going to be long-term. Maybe there'll be some results before the next election. But, I mean, in the here and now, social care needs a lot of emergency funding, doesn't it?
It does. And I think something that's been slightly missed out of much of the discussion in the last few days is precisely that. We have a system at the moment that only provides care for those who haven't got enough money to pay for it themselves at all. And we really desperately need to fund that properly. And just about every year for the last 10 years, the Treasury has announced emergency funding during the year to prop that system up. Well, that's crazy. It means the money doesn't get spent properly. And we need to have a grown-up discussion, which we should have right now, that produces a sensible long-run 2 or 3 year spending settlement for social care in the next budget. That's in some senses Andy Burnham's most urgent task.
And finally, in 20 seconds, if he does not succeed, if he, like all the others who made all these promises, fails, what are the consequences for our society?
Well, at the moment, I mean, he said himself that this is a stain on the political class. It is. It's a stain on people like me. But we're just letting ourselves down. And hundreds of thousands of people and their families who need care, millions of people who work in care, millions of people who provide care are having an unnecessarily miserable life. We can do much, much better. And although it will have a cost, it's a cost that's well worth paying.
So, Andrew Durnott, thank you very much indeed for joining us.